Hi, my name is Judy Partington. I've lived in Hastings for 61 years, yay. But yes, so we're just here to talk about the Medicare Advantage plans with United Healthcare and their other plans that are available. This is a formal specific training, so. And then this is Nancy. She's also with me. She's going to give the meeting today.
Yeah, my name is Nancy Green. I'm with Integrated Insurance Agency. It's a family business that we have, and we are independent brokers, so we have all the different products in Minnesota and other states such as Wisconsin, South Dakota, North Dakota, Illinois, Michigan, Florida, Arizona are some of the primary states that we work in. We have about 80 agents as part of our team, and Judy is one of our independent agents that lives right here in town.
And we help you out at no cost to you, so.
That's right, and we're here to help somebody find the best plan that works for them. And today we're focusing on United Healthcare. Okay, and we have someone from United Healthcare. We have Maggie, who is from United Healthcare. And we have Dave, one of our other agents here as well. So our agenda today is we're gonna talk a little bit about Medicare. We have to give you some Medicare education information. We're also going to, am I in the video? Do I have to stand a certain
Do you
place?
want me to still stand here?
Where should I stand?
No, it's pretty wide.
Okay, it's pretty wide, okay. And we're recording this for some agent training, so thank you for being patient with that. So we're going to have some Medicare education, which we'll review in this booklet. We're also going to cover some of the basics of United Healthcare's plans. They have many plans. In Minnesota, we have Medicare supplements, Medicare Advantage, and Part D plans. And then we're going to talk about one plan in particular, a Riverbank plan. And the meeting should last about an hour or so. We can sit with you, answer your questions afterwards. Judy can make an appointment with you to meet with you one-on-one. You cannot enroll right now because it isn't October 15th, but you can get some information. All right, so let's start with the Clarity Guide. And if you open that up to page 2, okay? Now, what was your name?
Tom.
Tom?
Deborah.
Deborah. Tom and Deborah. Deborah, you have Medicare. Tom, do you have Medicare yet?
No.
You don't?
I'm not 65.
Pardon me?
I'm not 65.
When do you turn 60?
April of 22.
Okay, all right. You're doing your research ahead of time.
Correct.
That's wonderful.
But I'm already drawing Social Security.
Oh, okay. Very good. All right. Well, let's go to page 2. And when you turn 65, you're going to get a Medicare card. And since you're drawing Social Security, it will come to you automatically for your birth month of April of 2022. Medicare includes Part A and B. A is your hospital and B is your doctor visits, your MRIs, your CAT scan, your chemotherapy. That falls under Part B. With Medicare, there's Original Medicare. There is a Part A deductible for the hospital of $1,484 per 60-day benefit period. So person that has Original Medicare isn't responsible for that. The Part B of Medicare is 20% of the Medicare allowable amount, and somebody who has Original Medicare would be paying 20%, and Medicare would be paying 80% with no cap. So oftentimes we make a decision. Should we go with something to help fill in that gap of Medicare because it doesn't cover everything? So there's 2 options. There's option 1 and option 2. Option 1 is a Medicare supplement or Medigap. That's where you have a company, a private company, United Healthcare as an example. They have the, I don't know where it went. Oh, here it is. They have a Medicare supplement enrollment guide, and we would then help you find the best supplement that would work best for you. In Minnesota, what happens with the supplement is we put you on a basic plan or an extended basic plan, which will cover all of your medical. So you would pay $0 for all of your medical except for a Part B deductible, annual small deductible, a little over a couple $100 a year. Also, you would have all of your hospital paid for. In Wisconsin, we would have something a little bit different. They're age rated based upon your age and whether you're a smoker or a non-smoker. In Minnesota, Medicare supplement averages about $240 a month. And they call it a Medigap. It fills in the gap that Medicare doesn't cover. So it will fill in the 20% and all of your Part A deductibles. And I'm not getting into every single Part A deductible. That's something we could get into if that was something that made sense for you. Also, you need a standalone prescription drug plan, and that drug plan averages about $30 per month. So I look at the supplements and say, Medicare A and B, your original Medicare is primary, and then secondary is your Medigap or Medicare supplement. And with that, you can go anywhere in the United States that takes Medicare and pay almost no copay or premium. So you pay, or not premium, but copays or coinsurance. So you pay upfront for getting all those different services. The option 2 is a Medicare supplement plan. And this, you have Medicare A and B built into the plan, and we call that Part C. Many of the Advantage plans also have prescription drug coverage and any other benefits such as vision, dental, hearing. With United Healthcare, you can go anywhere in the United States that takes a Medicare Advantage plan for United Healthcare, and oftentimes you'll pay the same copay in or out of network. So the premiums can vary anywhere for United Healthcare from $0 to $99 premium per month. But you pay a copay and you pay coinsurance. So you pay as you use the plan. Any questions? Yes.
Just back, excuse me, back to the supplement. If you were on the supplement, then you don't pay anything like for radiation.
Correct.
Or chemo, or if you needed you needed a back brace, you pay nothing.
That's correct. If we go on a low deductible plan, and we usually use the basic or the extended basic, so you don't pay that.
Right.
You pay a $203 deductible for 2021 annually, and that's it.
Right.
And then, but you pay a large premium.
Right. Whereas on the Advantage plans, all of them you have to pay 20% on chemo, right?
A minimum of 20% for
minimum
chemotherapy.
And all your durable goods you pay 20%.
Correct. Correct.
Okay.
Yeah, but the difference is that the Advantage plans, I happen to have the $99 plan with United Healthcare, and I have a maximum out of pocket of $3,000. So if I have cancer and I have chemotherapy or radiation and I'm paying 20%, which can be very expensive. One of my clients paid $55,000 for that first month of his cancer treatment, but I have that maximum out of pocket where I never pay more than $3,000 annually. So in the Medicare Advantage, there is a cap of and that will vary according to the plan that you're on. Anything else? All right, let's go to the next page, page 3. Okay, so Tom, when you turn 65, you're gonna want, are you working?
No.
No. So when you turn 65, you'll be in your initial election period. And that's when you can enroll 3 months before your birth month, or 3 months after your birth month. So your Part B will be effective April of 2022. Your new plan, whichever plan you pick out, will be effective April of 2022. And that's your initial election period for your Advantage plans. And if you had a supplement, you would have a 6-month guaranteed issue, meaning no medical questions asked. So you have that choice to go the Advantage plan or to the supplement plan. Whatever works best for you, okay? Now, we're in the annual enrollment period, which goes from October 15th through December 7th. That's when you can change your Medicare Advantage plan. So Sue, right? No, not Sue.
Deborah.
What?
Deborah.
That's right, Deborah. Okay, so Deborah can change from the current plan to a different plan right now, starting October 15th. And Judy could sit with you and compare the plan that you have against the United Healthcare plan. And as you go through this, you will see some of those differences that you're aware of, okay? Also, if you make a decision and you're not happy with your decision, you can have a sign up for the first quarter and change your plan from Medicare Advantage to a Medicare Advantage, okay? If you move, so Tom, if you moved to Minnesota, you would have a special election period. And that's when you could change, if you started in Wisconsin on an Advantage plan and you go to